on families become unbearable. Why does this happen? Because for decades, the cost of screening, of diagnosis and treatment has been placed squarely on the shoulders of women and their families. An out-of-pocket burden that has silenced too many and left too many without options. A woman should never have to choose between feeding her children and saving her own life. A woman should never have to lose her home to pay for cancer treatment. And yet, this has been the reality for far too many Ghanaian women. But today, I stand before you to say that that reality is changing. Madam Chair, His Excellency, the President of Ghana, John Dramani Mahama, has made healthcare equity a cornerstone of his administration's agenda. He understands something fundamental. A healthy Ghana is a prosperous Ghana, and no woman should be left behind in our healthcare system. I have watched him champion this vision, and as First Lady, I am deeply committed to standing alongside him and supporting its course to success. What excites me most about this moment is what is already happening on the ground. The Free Primary Healthcare Initiative now includes breast cancer screening, meaning women no longer must choose between health and survival. The Ghana Medical Trust Fund is also stepping in to ease the financial burden that has devastated so many families when a diagnosis comes. And I see in this room, gathered around this team, all the people who make real changes possible: the health workers, the policymakers, the researchers, the advocates, and the survivors themselves. These are not just policies on paper, they represent a fundamental shift in how Ghana values and protects the health of its women. And I am honored to support this work in every way I can. Madam Chair, our theme is bridging the breast cancer care gap for everyone, every step, everywhere. Let me tell you what I believe this means. For everyone means this: it does not matter if you live in Accra or in a remote village. It does not matter if you are wealthy or you're struggling to make ends meet. It does not matter about your education level, your ethnic group, or your social status. Breast cancer screening and treatment are your right as a Ghanaian woman, period. Every step means that we are not just thinking about one moment. We are thinking about the entire journey: prevention and awareness, screening and early detection, diagnosis and treatment, survivorship and support, psychosocial care. We are building a system that walks with women through every phase of this difficult journey, not abandoning them halfway through. Everywhere means that we are committed to breaking the urban-rural divide that has characterized healthcare in Ghana for far too long. A woman in my husband's village in Bole deserves the same access to quality screening and care as a woman in Accra. Geography should not be a barrier. And through the commitment to decentralized care and community-based screening, this is becoming a reality. But let me also be honest with you. Announcing a policy and implementing it are two different things. Commitment looks good on paper, but real change happens in clinics and community health centers. Real change happens when a health worker takes time to counsel a woman about breast self-awareness. Real change happens when a woman who is afraid goes for screening because she knows it is free. Real change happens when someone receives a diagnosis but also receives a pathway to treatment without other prohibitive barriers. This is why this conference matters. This is why every one of you matter. So I'm asking each of you to lean in, to commit, to own this work. To our health workers, you are the bridge between policy and people. You are the ones who will make free screening a reality in every corner of this country. I ask you, therefore, pleadingly, to equip yourselves with knowledge, to engage your communities with compassion, and to ensure that no eligible woman is missed. You are not just a healthcare provider, you are champions of change. So our policymakers and partners at NHIA and the Ghana Medical Trust Fund, your work is to ensure that the commitments being made are not hollow. Monitor accessibility, measure outcomes, hold yourselves accountable, ensure that money flows where it is needed. Ensure that barriers, whether bureaucratic, logistical, or financial, are removed. The success of this initiative will thus be measured not in policies written, but in women who are treated and in lives that are saved, in futures that are preserved. To the Breast Society of Ghana, you are a voice of those most affected. Continue to advocate fiercely, even when you are tired, even when you think nobody cares, especially even when you feel it is a hopeless cause. It is not. Show the gaps. Teach us all. Celebrate your successes. Your expertise in this matter and your advocacy are completely invaluable to this collective effort. To survivors and to patients, your stories are powerful. They are your life, and you're living it graciously. More powerful than any statistic and any speech, any policy document, any government announcement. When you share your journey courageously and bravely, the fear you faced, the barriers you overcame, the hope you found, you give permission to other women to seek help. You break stigma. You create a community. Thank you for your courage. Please continue to speak your truth. To all stakeholders in this room, let us commit to leaving no one behind. Let's measure progress. Let us commit to accountability. Commit to the belief that a Ghanaian woman's health is not a luxury or a privilege. It is a right, inherent, and it is worth protecting. Bridging the breast cancer care gap must therefore not be viewed just as a health issue. It is also a gender equity issue. It is an economic justice issue. It is a human rights issue. It is about honoring the dignity and potential of every Ghanaian woman. Breast cancer will remain a serious health challenge, but it does not have to be a death sentence. It does not have to be a financial catastrophe. It does not have to be a barrier to a woman's dignified livelihood and future. Through free screening, through financial protection, through the Ghana Medical Trust Fund and the National Health Insurance, through the dedication of health workers, through the advocacy of civil society, through the parliamentary select committees on health, and through the President's commitment to healthcare equity, we are providing the change we need. And we are proving that change is possible if we work together. As First Lady, that is Auntie Lordina, I stand with you in this mission. I will continue to lend my voice, my presence, and my support to ensuring that every Ghanaian woman has access to the care she deserves. I'll listen to your experiences and I will amplify your voices in the kitchen, in the bedroom, and in the living room. And I will hold this vision for everyone, every step, everywhere, at the forefront of my work. The work ahead is significant, but so too is our collective will. I have seen it in this room, and I have heard it in your voices and your stories. Together, we will ensure that breast cancer care in Ghana is for everyone, every step, everywhere. Not someday, not eventually, but now. I thank you for your kind attention, and I wish you all the best in the remainder of your activities.
So that's an example we wish every individual or corporate body to follow. We have a brand new website. If you just, right now as you sit here, just go on to Breast Society of Ghana website. And you can just type it in like that, Breast Society of Ghana website, you see it. And even when you go to the donation button, you see now we have Paystack. You can donate as little or as much as you want. Just click on the button, 100 cedis, and something will go to push somebody somewhere. So together, let's use this meeting as an opportunity to renew our resolve, strengthen our partnership, and accelerate our efforts toward a future where quality breast cancer care is accessible. Finally, let me invite you all to our breast cancer awareness walk. It will be coming on the 24th of October. We'll start at the Independence Square, and we will march through some principal streets of Ghana. So I hope to see you all there. Thank you all so much, and I hope we have a fruitful and a memorable discussion. Thank you.
Thank you. My name is Professor Josephine Insafo. I'm the president of the Breast Society of Ghana. I'm also a surgeon at the breast unit of the Korle Bu Teaching Hospital. So today is our annual general and scientific meeting. And the theme for this year is bridging the breast cancer care gap for everyone, every step, everywhere. And what we're talking about is, indeed, we have everything it takes to treat breast cancer in Ghana. But we are aware that the situation is not perfect in terms of accessibility. So we are having a national conversation as to how various stakeholders can come together and bring breast cancer treatment closer to patients. I think first of all, even the fact that breast cancer is treatable, is curable, is far away from our minds. It's not accessible in our minds. So we need to create awareness that breast cancer is not a death sentence. And we have to do away with the stigmatization in society and know that it is curable. We have a lot of survivors here today who can even share their stories. And we have to put a warning out there that all those herbal and spiritual alternative treatments, they do not work. But we have researched methods at hospital that work. If we get the cancer early, it is curable. We also know that geographically speaking, the main cancer centers are in Korle Bu and Accra. So we have, policy makers, the Ministry of Health is here, government representatives, they are here, and we are talking about how their plans are going to bring breast cancer treatment closer. Indeed, with the new policies, there's certainly some plans which are in the pipeline to bring treatment closer to patients, because for now, patients have to travel across country to be able to access radiotherapy, for instance. And then, of course, even the Ghana Medical Trust Fund, NHIA, they're all here and discussing how we are making treatments more financially acceptable. So that's the meaning of our thing, bridging the breast cancer care gap for everyone in Ghana, everywhere across the country, every step of your cancer diagnosis. We are seeing more people with breast cancer, a lot of young people too, that's concerning. But we think that because the awareness is increasing, people are hearing of it, they are now stepping out. We are making some way with the message, but there's still a lot that can be done. Unfortunately, sometimes when people do eventually come, the disease is already far advanced. So what we want to continue teaching is that come, but come early. And we believe that when people change how they think and see breast cancer, it becomes a national conversation, a conversation at home. It will make a difference. We are making the appeal to all women to get their breast screening started. Your own screening at home every month after your period, you should check your breast. Once a year, you should go to the nearest health facility and let a professional check your breast as well. Now with the free primary health care at all the lower facilities, everybody can get a breast examination for free anywhere in this country. Something may be detected and then it can be referred to the higher cancer centers. And when you get to the age of 40, do start doing a mammogram. Every 2 years at least is okay, just by way of breast screening, so that we stay ahead of the...
I've survived breast cancer for 7 years now. It started in 2014. I felt a lump in my breast. I went to hospital for it to be examined to see what it was. When the doctor examined it, the amount he mentioned at that time, I didn't have the money. He said it will cost me, the biopsy will cost me 1,800. By then it's 18 million. I didn't know where to get that money. And this lump in the breast wasn't paining me. So I just left it. I left it from 2014 to the latter part of 2018. Around 2018, when you look at both breasts, you see that the other one that has the lump in it, it's looking different than the normal one. So I had to go to hospital. Even with that, it took me to 2019 before I went to hospital. All these years, I didn't feel any pain in the breast, but the lump was just growing. So when I went to the hospital, the doctor examined it, and then he told me this looked cancerous. But then he would do biopsy to see what it was. He did the biopsy, and then it confirmed it was breast cancer. So he told me he will refer me to Korle Bu. In fact, I went to Achimota Hospital. And I asked him, why Korle Bu? Because those days, when you hear of Korle Bu, the only thing that comes in mind is you are going to die. But the doctor made me understood that everything about cancer, it's been done in Korle Bu. So he will refer me there, and then I'll start the treatment there. So I went to Korle Bu. I went with all the reports I have from Achimota. When I got to Korle Bu, the doctors also wanted their own reports. So they also asked me to go and do a lot of reports, test and bring the report. So I did that, I brought the report, and then they also confirmed it's breast cancer. So they said they would start the treatment. They said they would start with chemotherapy. I would do 6 cycles of chemotherapy. By then, I have a long hair. I used to be a beautician. I have grown my hair to a certain length that I needed a beautiful style. But the breast care nurses made me aware that chemotherapy is going to affect my hair. I'm going to lose all my hair. So they told me if I should start, if I can start wearing wig cap. But then I do wig cap for people, but I have never worn wig cap before. And this is the time for me to do wig cap for myself. And you know, women, losing our hair is not an easy thing for us. When I started the chemo, I lost my whole hair. I lost the whole hair. The scalp became like this side. And each time I go for the section, the moment the hair start growing, I have to lose it again. And then I have to go for the section. It wasn't easy. Going through chemo wasn't an easy thing. Your whole body changes. You become a different person. You can't eat. Anything you eat doesn't taste well in your mouth. But then you need to eat to be able to go through the treatment. I was able to go that. They did the surgery after the chemotherapy, and then I went in for radiation. I did 25 cycle of radiation. Then afterwards, they put me on hormonal therapy, which I was told I would take for 10 years. By God's grace, I'm in my 7th year. It hasn't been easy, but God has been faithful. Listening to the doctors, doing all that they told me to do, and adding prayers has brought me this far. And after my treatment, I joined a foundation called Modloko Breast Cancer Foundation. We told the doctors that if God has given us another chance, we would like to come to Korle Bu every Wednesday to encourage a new breast diagnosed patient, because in our time we didn't see any survivor. It wasn't easy. We didn't know from this stage where to go, but we coming as a survivor to help the newly diagnosed patients, it really helped well, and it has been amazing work till now. We are in our 6th year. It has been amazing job, because you taking care of a patient going through the treatment and coming out, it's a huge blessing. It's a huge blessing. And I'm grateful to God that I'm doing something like this to help others. All I want to say is, if I had money in 2014 when the doctors saw this lump in my breast, they would have just taken the lump from the breast. But because I didn't have money, I wasted all those years. But then I wasn't in any pain. I think because I wasn't in any pain, I just decided I would leave it alone. Then I started realizing that the breast is changing. But after going to hospital to do the treatment, this is me. I lost my whole hair when I was doing the chemotherapy, but today, this is me. This is my natural hair. I don't have any attachment in it. I have left it to show to other survivors that there's hope after the treatment. So I'm urging all ladies that if you feel any pain or you see any difference in your breast, please don't waste time. Go to the hospital. Thank you.